Sometimes people call up and say, Don, I want to do exclusively emotion-focused therapy. I've researched it. This is what I want. So,
what is it actually?
Well, emotion-focused therapy was developed by Susan Johnson out of Canada. And it is also a highly empirically driven, which means it's science backs it, and it works. And we know it works. And what happens with emotion-focused therapy is that if I'm doing emotion-focused therapy with you and your person, if I'm a minute ago or I'm a minute ahead, I'm not an EFT. I'm not an EFT. What happens is we only look at the emotion. So the theory behind it, also attachment theory, but what happens is that people go into emotional distress and the other person isn't seeing their pain. So what happens is they go into what Sue Johnson calls these predictable dances, and you'll have one of them. So what happens is you take turns up-regulating your partner. And what they call, you throw bullets. You don't shoot them, but you throw bullets. And what happens is that keeps this up-regulation. But you're fighting here. But what you're really fighting about is the underlying feelings, right? So what we want to do is we want to stop and see that dance as the enemy. So what happens is this. I say something to you. That's a behavior, right? I'm saying something. You...
How dare you?
Yes. Yes. And well, maybe that happens. So what you would do if you say, how dare you, which I love it. You did great.
Actually, you're the opposite. You're a good guy.
Well, you know, I think everybody's a person, right? But what happens is that person listens to the behavior and they attribute something to it. You know, now, where the Gottman method, we talk about meta-emotions, so meta-emotions are extremely important. What happens in the methodology for emotion-focused therapy is you go into what we have as what we call secondary emotions. Secondary emotions aren't secondary like they're lesser. They're secondary because they're feelings you feel after you feel something else. And they're usually like happy, sad, glad, mad, right?
Right.
So let's say you say something.
Remember, those from kindergarten.
Right, that's what they teach.
They used to teach us that back then.
Yes, and the basics, right? Right. But as you got older, what you probably noticed is they would teach you things like, I felt disappointed, I felt worried, I felt confused, I felt alone, I felt abandoned, I felt voted off the island, I felt not cared for, I felt just despair. These are feelings that might be fueling the anger. So all you're getting from me is anger. So that means, well, you're angry at me, I'm going to be, you know. So what happens is that you give a behavior, right? Then I give an attribute to that behavior. I attribute something about you, about that behavior. Right. Go into those secondary emotions, right? I'm mad at you. But underneath it, what you're not seeing is I'm scared and lonely. And then that hits my abandonment. And then what I do is I come back up and I start with this. So I give you something, so now you attribute my harsh tone, right? So you're ready to fight. So now your harsh tone makes you angry or indignant, right? Or you know, maybe sad. But what you're also doing is your primary feelings are kicking in. Now you're feeling worried. Maybe you're afraid that we aren't friends anymore. Well, if I'm not friends with Don, I really enjoy talking to Don. So now I'm feeling alone and abandoned. So I don't want to feel alone and abandoned, so now here we go into this dance, right? So what happens with emotion-focused therapy is I watch people go back and forth, and I slow it down that much. So I might say, so when she said that, where did you go? Now you notice my voice drops, because now I might be talking to a very flooded brain that is like freaking out. So I go, wait a minute, what did you experience? And you might say, well, you know, it's just, did you notice your voice just changed? And I just slow it down right now in the moment. So then all of a sudden, let's say you start to cry. So I look to your person and I said, what do you notice? Okay, so when that happened, what did you start experiencing right now? And we begin to go back and forth to see that. So what will happen a lot of times at the beginning is people will go right back into the dance.
Right.
Right? So what do you notice? They're crying. Well, I really don't care that they are crying. Well, I don't care that you're crying. It's right back into
back and forth, yeah.
But what happens is eventually people just get to where they're both very sad and vulnerable.
Yeah.
And what I do is I say, can you be really brave and make a move
Right.
to talk about their vulnerability?
Right.
What was that like when she noticed?
Mm-hmm.
Wow. So I go back and forth. So now you at some point can notice their vulnerability. Can you look at her and tell her that right now? No.
Yeah.
All right, stay
So
with
then
me.
stay with you. Right.
It's okay.
Right.
But let's see what we can do. A lot of times what you'll see in that is people won't have words
Right.
because they don't know a lot of their
They
words.
don't know.
So I might say to them, if it were me, I might feel really abandoned and alone. That would scare me. Do you feel scared?
Right.
Can you tell them you're scared right now? So what happens is that we begin to get these two, rather than to go into dance, to go and really come for each other's vulnerability. A really amazing thing happens when we do it. Something like this will happen. Somebody will say, you know what, I really want to tell you this right now, but that's that dance. What I'm recognizing is you're really hurting right now. And what I need to do is really go for that.
Yeah.
So you go into that, you start to get into stage 2. Right? And then with the stage 2, we begin to say, okay, well, that enemy, that dance thing, and I usually have them name their dance, and I get some pretty funny names. But once you can really stay in stage 2, then you go to this natural step of resolving the issues. I have had people come in and they say, I cannot wait to argue this one out. And at the end of this, when we get into stage 2 and stuff, I'll say, what did you come in to argue? And they'll go, I can't remember what the fight was about. Because what you've done is you've gotten them to go to their attachment and their bonding, and once they feel safe with their person, they didn't need the dance. So emotion-focused therapy is in 3 stages, and usually what you try to do is to recognize the first, get to the second, and then help them negotiate step 3. And then what we do in that stage, there's kind of fancy words to that, which is kind of like pursuer softening. And what we do is we help people kind of ramp down, and I could get into the technicals of it, but basically what you're doing is getting them to kind of abandon the dance and go towards bonding with each other again.